oftentimes people don't know it or don't know the intricacies of it.
Engaging with the community since 1970.
Just encourage people to get a little bit of education.
This is WIS Awareness with Billie Jean Shaw.
Happy Sunday to you. Thank you so much for joining us for Awareness. I'm your host, Billie Jean Shaw. Today we are having a real talk about what it means to be a black person and some of the disparities we face in healthcare. Today's topic, we're going to start off talking about the black maternal health rate in the U.S. So according to the CDC, black women are 3 times more likely to die from a pregnancy-related cause compared to white women. The CDC says multiple factors contribute to these disparities, such as a variation in quality of health care, underlying chronic conditions, structural racism, and implicit bias. Joining us today for more insight on this topic is TK Curtis Pugh, the Executive Director of the South Carolina Nurses Association. TK, thank you so much for being with us.
Thank you for having me.
First of all, just starting off, as a black mom yourself, when you were going through your process of building a family, did you ever feel as if you faced any type of disparities being a black mother?
Actually, yes. And oddly enough, sometimes people think that if you're insured, you don't have these challenges. Had very good insurance, had great doctors, but at the time, the physicians that I had did not understand me. They didn't listen to me. And I struggled through a very long battle with infertility because of that. And when I switched to a doctor who looked like me, who understood me, who was a female, who happened to be a black female, she really was able to tap into some of the challenges I was having, and I really was able to have a voice at that point.
Wow.
So yeah, it doesn't matter if you come from an insured background, if you're well off, quote unquote, doesn't really matter. Every woman of color is facing a challenge in the maternal health space.
And it doesn't matter your occupation because you're a nurse.
Exactly.
And so you still went through some of the same things that everyday black women go through. When we talk about this data and we look at the health rates when it comes to black maternal health in the U.S., the statistics are very bothering. They bother you. They're very, I can't even find the word, just like really outrageous when you think about black women 3 times more likely to die compared to white women. What are some of the reasons for that?
Well, one of them is having a voice. Oftentimes, if you think about us historically as black women, we have always been taught to kind of listen to our doctors, listen to what they're telling us, right? But the opposite of that is true. Not to say you shouldn't listen to your providers, but you've got to challenge things, and we haven't been taught to challenge. We can sometimes we can be labeled challenging, but honestly, we haven't been taught to challenge. When my doctor says I have this going on, my doctor says I need to take this medicine, we do it. But we don't think about how does this really impact women of color. So maybe that particular medication isn't the best for a woman of color. Maybe it's not the best for a woman of color who has multiple children or who has other pre-existing conditions. So all of those things come into play when you think about, is this the right space for me and this is what's happening. So that's one, is us challenging and making sure that we're being advocates for ourselves. The other piece of that is oftentimes we have mental health issues in the maternal health space. We talk about postpartum depression and perinatal issues and things like that. The big piece of that is when someone is struggling with what they've experienced from a postpartum or perinatal situation and no one's hearing them, and that mother can't figure out why she can't connect with that child, or she doesn't understand why she's getting frustrated because of that child fussing or being upset, which is what babies do, and they can't handle those emotions, that's a challenge. So then we have a whole mental health crisis that's attached to what happens with black mothers. Of course, socioeconomic status also plays a role in that. When you don't have access to that health care, oftentimes you don't get the health care you need. The age of a woman has a lot to do with that. On both sides of that, younger women are having babies, but truth of the matter is older women are having babies.
That's true.
I'm 43 years old and I have an almost 2-year-old. So I think about how old she's going to be when she leaves my house. But there comes some challenges with that as well. So we have to think about all of those things in place: socioeconomic status, educational levels, being able to advocate for yourself, and then having a provider who's really listening to you as well.
And TK, I think it's important to let our viewers know this is something that you're well versed in, this topic specifically. You just came back from DC presenting on a national stage about this. When you go through your slides and you go through the information and you really break down not only what's happening here in South Carolina, but in other states across the country, what are some of the surprising factors as far as feedback that you receive that you think that really resonates with people?
People don't think this is true. And that's really sad. People don't think that there is this huge gap, this disparity between what's happening with Black women and what's happening with every other population of women. When we think about women of color, non-Hispanic women of color, so that's primarily Black women, almost 50 births for every 100,000 end in some type of maternal mortality.
Wow.
That's terrifying for any mom. One is too many. So people don't realize this is happening. As much as we talk about it, as much as we're talking about it on national stages, they just don't see the disconnect, because oftentimes they're like, well, they have the doctors and they have the nurses and they have all these people who are advocating for them, but they may not be really advocating for them. And there's so many factors that play a role in that. There's what's happening in that hospital system. Do they have real access to care? Where are they located? Because your zip code could determine your birth outcome.
Ooh.
And that's really, really challenging, and especially here in South Carolina. Rural South Carolina, we have multiple hospitals that have closed. Our federally qualified health centers are struggling. So there's so many pieces that people need that care, our DHEC facilities, and they can't get to them. And that goes back to infrastructure. That goes to all these different pieces as to how we make sure people get the care that they need. They have providers who care about them, and they have people who are fighting for them. So it's happening here at home, and it's happening nationally.
All right, TK, we're going to pause right there. When we return, we are continuing our conversation specifically about the lack of diversity in healthcare, the Black maternal health rate, rather. We're going to talk about why people of color are needed in the healthcare field and how it really plays a major role into the care that we get. We'll be right back.